Poštovana potpredsjednice, povjerenice.
Vice President, Commissioner, colleagues. Healthcare standards in the EU are not harmonized. There are great disparities between regions and member states. There is greater chance that you will die of cancer if you live in a less developed region of the European Union, which is inadmissible. We have to do everything in our power to do away with these disparities, and the cohesion policy is the instrument that we have at our disposal. It promotes growth in all regions, especially those who lag behind in development. A third of the EU budget is dedicated to this goal. Cohesion policy is an important investment policy, but also an expression of solidarity. Cohesion policy makes great investment has made great investment through the European Regional Development Fund and the Europe Social Fund of 24 billion euro in the previous programming period. This is 5 times more than the funds from the EU for Health program. However, the inequality of healthcare among member states is still true, so we need to increase investment, and we need to direct investment and use it more efficiently. This report highlights the major problems but also offers solutions. Unequal healthcare is especially visible when you look at the infrastructure across Europe and the lack of healthcare professionals, which has an impact on treatment, especially in less developed regions. Investment in healthcare and healthcare infrastructure is an urgent matter, especially taking into account the economic and social ramifications of the pandemic. Those who live in faraway regions often encounter great obstacles to healthcare, which means they are not able to use all the available healthcare services. They must not become second-class citizens. Healthcare has to be accessible to everyone. In order to surmount all the obstacles present in rural areas, advanced technologies like e-health have to be used in order to increase access to healthcare. Furthermore, we have to motivate healthcare professionals, doctors and nurses to come to less developed regions and rural areas and work there, because these regions often face a brain drain. A strategy to keep healthcare professionals in such regions also will be developed. The report also makes mention of healthcare excellence centers for various diseases across the EU and puts focus on cross-border cooperation. We need to use all instruments such as Horizon Europe and EU for Health and set up different centers across Europe. The report especially emphasizes the importance of the Interreg program, which has contributed to the fight against the pandemic. Projects which enable contracts between hospitals and healthcare providers is very important because it makes healthcare accessible in border areas. And finally, it is extremely important to evaluate the impact of healthcare policies and the cohesion policy to see how well this impacts the treatment of cancer. The COVID-19 pandemic is a turning point when it comes to investing in the healthcare systems. So I call upon member states to continue investing more within the following programming period in order to meet the health needs